The platelet bag was not inspected closely. No one held it against the light. No one questioned the faint change in color. Pale yellow. Within expiry. It was issued. It was transfused. By the time anyone noticed something was wrong, the bacteria were already in the bloodstream. The patient was already dying. We talk about killer nurses. We talk about surgical errors. But some deaths don't need a human weapon. Sometimes the blood itself becomes the crime. This is blood crimes, and this is the story of the platelet that killed. The patient was stable, not critical, not dying. Low platelet count, a routine indication, a routine order. Relatives signed consent without fear. Doctors reassured them. This is safe. It's just platelets. No one warned them that platelets are the most dangerous blood component ever transfused. The platelet transfusion started quietly. First 10 minutes, nothing unusual. Vitals stable, no alarms. Then it began. Chills, sudden fever, heart rate rising. The patient complained of discomfort, but the drip kept running. Fever during transfusion is not subtle. It is not rare. It is not harmless. It is the body screaming. But instead of stopping the transfusion, someone said, probably a mild reaction. Paracetamol was given. The platelet bag stayed connected. With every drop, more bacteria entered the bloodstream. Minutes turned into chaos. Blood pressure fell. The patient became restless, then confused. This was no longer a reaction. This was septic shock. ICU transfer, vasopressors, oxygen, ventilator. The same platelets that were meant to prevent bleeding were now destroying organs. The patient died within hours. What really happened? Platelets are stored at room temperature, not refrigerated. That makes them perfect breeding grounds for bacteria. One contaminated collection, one missed skin organism, one lapse in detection, and the transfusion becomes an infusion of sepsis. This risk is well known. This death was not unpredictable. After the death, something else happened. The blood bag was discarded. No culture was sent. No report filed. The death certificate blamed the illness. Once the bag was thrown away, the evidence disappeared. And so did accountability. This was not fate. This was not bad luck. This was failure to recognize danger. Failure to stop transfusion. Failure to report the truth. Platelet sepsis doesn't just kill patients. It survives because no one wants to talk about it. This patient did not die from disease. They did not die from bleeding. They died from contaminated blood and the decision to ignore warning signs. Hospitals don't need weapons to kill. Sometimes they only need silence. This is Blood Crimes.